And before we get started, I will let Martin read our introductory remarks.
It is requested that participants introduce themselves every time they speak. Roll call votes will be taken for every action item. This meeting is being recorded for minute-taking purposes, as well as for posting of the recording of the proceedings on the agency's website. This meeting is also being live streamed on the Access Health CT website. Thank you, Mr. Chair.
Thank you, Martin. And would you kindly call the roll, please?
Yes, Mr. Chair. Sean King, Chair.
I'm here.
Deb Poland.
Here.
Sheldon Taubman.
Here.
Elisa Naira.
Here.
Maria Matos. Jacqueline Sanchez. And Jared O'Sullivan, subject matter expert from SID. Mr. O'Sullivan, I believe you're on.
So I am here.
Thank you.
Thank you very much and welcome everybody. Before we get started with our first agenda item, if I could have James and his team introduce themselves as well.
Good morning, all. James Michelle, Access Health Connecticut.
Good morning, everyone. Holly Schwick, Director of Finance, Access Health Connecticut.
Good morning, John Carbone, Access Health Connecticut.
Good morning, Tammy Hendricks, Director of Health Equity and Outreach, Access Health Connecticut.
Marquise Davis, the Director of IT, Access Health Connecticut.
Is that everybody?
Yes, for this meeting, yes.
Okay. And Martin, I think we have another advisory committee member who joined us late. Did you capture Elisa Naira's attendance?
Yes. Okay. Yes, I did. Yes,
okay.
I did. Thank you.
All right. And so moving on with the agenda. First is public comment. It's my understanding we have no public comment for today's agenda items.
That's correct, Mr. Chair. We did not receive any public comments today.
Okay, so moving on to item C, review and approval of the minutes. I will entertain a motion to approve the August 27th minutes.
So moved, Mr. Chair. Deb Poland.
Moved by Deb. I will go ahead and make the second. And if we could get a roll call vote, please.
Mr. Chair, are there any discussion on the minutes before us?
Any discussion, any comments? Seeing none, we'll take the roll.
Sean King?
Yes.
Deb Poland?
Yes.
Sheldon Taubman?
Yes.
Elisa Naira?
Yes.
Maria Matos? And Jacqueline Sanchez. Thank you.
Okay. All yeses, the motion carries. And so that takes us to the Health Equity and Outreach Department update. And I'm going to hand the mic over to Tammy for this. Thank you, Tammy.
Thank you, Mr. Chair. Good morning, everyone. Tammy Hendricks, Director of Health Equity and Outreach. I have some department updates for you all today. It's been an interesting year. Going into this open enrollment, we knew that there would be some major changes for consumers, especially around cost and plans. So our team really spent a lot of time planning how we could stay ahead of these concerns while keeping them engaged and informed. And so a part of that meant expanding in-person support. Right, we've talked in the last few meetings about the new mobile team that we recently added, but we've also been working with our expanded list of community partners and supporters throughout the state. And so I'll give you some updates on kind of each of the buckets that we work with, right? So we do a lot of in-person enrollments and events. But we also stay very consistent with the engagement with our community partners. And then how do we work with those partners to further build enrollment capacity in different communities? So starting out with expanding access and the in-person support. This year, we launched the new mobile team, which really helped us reach consumers in a whole new way. So typically during the open enrollment period, we have 2 fixed locations that we've done in the past. And now with the specialists, we're able to have 4 locations per day throughout the state, which is significant, right? And so when they joined, we had to find a way for how do we have consumers reach these specialists easily. So we launched a new appointment scheduling tool, which has been a huge success. Consumers really appreciate knowing that they have an appointment, they know where to go, and they'll see someone in a specific amount of time. So I'm happy to report that the mobile team is booked through January, and it happened very quickly. So the tool has been very successful, and we'll continue to build on that. And with the new team, we're seeing a lot of real results. And Deb, thank you for stopping by the fair in West Hartford. It really has been a busy open enrollment season for us, and we appreciate it. So November alone, we saw a 54% increase in visitors at the enrollment fairs and the locations. And we also saw a 45% increase in enrollments compared to last year. And just in 2 months that the mobile team has been in different communities throughout the state, they've helped over 800 people and they've also been to over 87 locations in just 2 months. So it's been a very successful in terms of open in-person enrollment opportunities for us. On top of that, the daytime enrollment activities, we continue to host fairs. And so the fairs are pop-up events that we host after hours and on the weekend to accommodate consumers who cannot make the daytime appointments. And just a quick note on all of the fairs and events that we host, we have implemented more safety protocols this year for consumers and for our staff. We wanted to make sure consumers feel safe coming into our fairs to get the help that they need. And so happy to report there's been no issues for us, and consumers really appreciate the thoughtfulness that we've put into making sure that the fairs are more secure and safe. Moving on to the engagement for partnerships, I wanted to highlight our community conference. It is the biggest event that we host as a team and as an organization, but we also have the Small Business Summit. But for our team, this is the biggest event that we host for our community partners. This year was a complete success. We had over 225 attendees. This included elected officials. We had a lot of guest speakers and panel discussions, right? This year, we really focused in on health equity, of course, a lot of changes for the open enrollment period, and on outreach strategies. And although that's our biggest event, we also host smaller events for community partners on a quarterly basis. And on a monthly basis, we hold chats. We do virtual chats to keep them connected. We also host a virtual chat for consumers as well to keep them informed. And these have been really important touch points. We're seeing the benefits. Consumers are coming to us. They're more prepared for the enrollment process. They're asking a lot of questions. And so, us keeping them informed has been really helpful going into periods that we're seeing a lot of changes. One thing I wanted to highlight here is, and I don't typically mention it a lot, but we have been keeping track of WARN notices, which this lists all the companies that are going to be laying off employees. And so with the new mobile team in place, we're able to respond really quickly to these WARN notices as they come up. And so we're able to get into those companies and help folks secure coverage when they need it the most. So that's been a highlight, and we've been well positioned to respond more quickly and effectively to those WARN notices. And kind of the final bucket here, we have a few focuses in the building enrollment capacity. First, the Broker Academy, one of our most meaningful programs here. This year's class was our biggest class, our most successful class, I would say. We had the highest number of students passing the state exam and graduating. As you know, all of the graduates are required to complete months of an internship, mentorship before entering the field. And so we had our recent class graduate at the end of October. Many of those brokers are now in the field with us at our enrollment events. They're doing their own enrollment events. And it's really good to see them getting back into the same communities that they're from and have strong connections to. So they've been really helpful in helping us with the large volumes of consumers that we've been seeing at the events recently. In addition to all of the in-person enrollment fairs and events, we have our 6 Navigator locations throughout the state. They also provide in-person enrollment support for consumers, and they're available year-round. And consumers can also access the resources that they have to offer as well. And finally, I wanted to just highlight our partners that have certified application counselors in their organizations. So organizations are able to come to Access Health. This could be community organizations, hospitals. We have a lot of health centers. They can have their staff go through our certified application counselors training to be able to enroll consumers that they serve. So our CAC program has doubled in size since 2022. And this is a free training that we offer. So my team is actively promoting it to all of our partners, and we hope that it really continues to grow. So I will pause here if there's any questions, comments, or feedback.
And I just realized what it was. I ended up going to the back office and yo una vaina ahí bien complicada.
Do we have any questions, Tammy, or comments? I don't see any hands raised. Tammy, thank you
Very
so
good.
much for that update. Appreciate the
Yes,
information.
thank you so much.
Okay, and right on time. It's we're about a minute ahead of schedule. Next is our open enrollment 13 update from Catherine.
Thank you, Mr. Chair. Good morning, members of the committee. I'm Katie Hearn, Associate Director of the EPMO, and I have an open enrollment status update for you today. Our call center and operations department have worked very hard to implement enhancements to the call center's interactive voice response system, or IVR, for this open enrollment. We can now use speech, so customers calling in don't have to rely simply on the keypad. They can use speech when calling in, and in addition to English and Spanish, we have other language options on the IVR, including Portuguese, Haitian Creole, Ukrainian, and Arabic. Also, callers seeking information this year on a particular topic can benefit from a new text a link feature that enables callers to receive helpful articles from our website via text message. Another feature added this year for OE is an auto authentication feature, and that allows consumers with an existing application to verify their identity within the IVR before speaking with a representative. This feature collects and validates caller authentication data securely, and it frees the agents up to address consumer needs more quickly and efficiently. Next, please. So moving on to enrollment information, our projection notices to consumers were sent successfully in the month of October, and our auto renewals and auto renewal notifications for both health and dental plans completed on schedule on November 25th. As a reminder, we do have a public enrollment dashboard with enrollment statistics on our Access Health website, and that is updated weekly. So there are even more recent stats there this week than I will have for you in a moment. And looking at this table here, our technical operations and analytics department shared projected enrollments for this OE. The department forecasted a decrease in health plan enrollments overall, in large part due to the expiration of the enhanced premium tax credits and due to the fact that the 400% cliff population will no longer qualify for subsidies for 26 policies. This table shows enrollment numbers as of October 15th, and then the projected enrollment numbers expected at the end of open enrollment on January 15th. Cover Connecticut numbers are expected to increase with a normal rate of growth because there continues to be no cost to the consumer for the Cover Connecticut program. And this table was shared previously in an October board. Next, please. This slide shows our enrollment numbers as of November 26th, year over year. Overall, QHP enrollments are down somewhat year over year. We do see a significant increase in full price QHP enrollments. Our full price qualified health plan enrollments were at 19,383 last week, which was up about 26% from that time last year. And not surprisingly, we see a bit of a dip in qualified health plan enrollments with financial assistance. The enrollments were 103,178 as of November 26th, down about 9% from that time during the prior OE. However, as I mentioned, Cover Connecticut continues to grow. Our enrollments this OE period were at 43,492, a 22% increase over last year. And finally, our standalone dental plans have seen some growth year over year. We were at 13,696 as of November 26th. That's a 3% increase over last year. There is still plenty of time for consumers to take action, to update their applications, to shop, to enroll in a plan. There is plenty of free help available to enroll, and we'll continue to provide you with updated and open enrollment figures throughout the OE period. Thank you.
Thank you, Katie. Do we have any questions? I don't see any hands raised, so I'm gonna, oh, I see Deb has an actual hand up.
Thank
Go ahead,
you.
Deb.
Thank you so much. And for the record, this is Deb Poland. Do we know how this compares with other states, either around us or other states with state-based marketplaces?
Deb, we don't have information from other states yet. So, but what I'm hearing is that my colleagues are reporting, and when we meet at NASHP, similar type of results, although our numbers are a little bit better than their numbers, just slightly, because in Connecticut we've been doing a lot of communication since July with our customers, making them aware of what's coming. So the sticker shock was kind of removed because they've known what was coming. So when they came to us, they were prepared. And we are seeing a trend that people are buying down. They're going from silver to bronze. So that's a trend we see not but across the country as well. Because so we know that they're coming in. They see the value of health insurance. They just cannot afford what they currently have in place because of the subsidies, but they're still buying health insurance.
Thank you. Through you, Mr. Chair, just to follow up. So the idea of buying down, I mean, my concern is that it's good that people will have some health insurance, but I do worry about medical debt that people will incur, or healthcare that they just won't receive because they don't have the financial resources to pay for that. So that's not really a question, but just a comment for us to pay attention to.
Most of the buy down are from the 400% of FPL group. All right, and as you know, all of our plans have the essential health benefits are included in all of them, and some of them, as we design the plans every year, we try to get as much into the first dollar category as possible, meaning that they would go and get services before deductibles or co-pays apply.
Thanks.
Sheldon.
Yeah, hi. I had a question, really, a question of ignorance. You introduced yourself as with an acronym that I don't know what it is.
Sure. I'm the Associate Director of the Enterprise Project Management Office at Access Health.
Enterprise Project Management Office, which does what exactly?
So Sheldon, we have a lot of, as you know, we're a small organization, about 100 employees, but we have a lot of projects going on to ensure that we have that we maximize our budget and making sure we are on target and on schedule with all the projects that we do, and we're within our budget. We have a team dedicated to overseeing the projects, all the projects going on, make sure they are properly coordinated, that there's a project plan, and we're adhering to the project plan. And we're sticking to the budget, we are sticking to the timeline. If anything changes, we know why it changed. So we have been very, no surprises, and we've been able to stay on budget so that if things change, we could get ahead of it, find out what's changing, why it's changing, and make adjustments accordingly.
Okay.
This is the common practice in the insurance industry. But most big companies have multiple project management offices, and we only have one, and that's to help us manage all the efforts we have going on. For example, every year, open enrollment is a project we start planning for it in July. And there's been a lot of moving pieces, and all the changes that are happening right now with respect to the federal government and state changes, we have to stay on top of them. So we have multiple projects going on, and you're going to hear you're going to get updated on a number of projects, big ones, later on in this presentation that Katie and her team are managing.
Okay, thank you. That's way more information. I was just asking what the name was. Anyway.
Well, I just want to make sure you and
I appreciate it.
put context, the value, the value. I think we've been able to save a ton of money because most of the organizations, they hire consultants to manage a project for them. And consultants
very expensive.
They're $250, $400 an hour. And so we are able to be much more. Not only are we saving money, but we get a better product because we have our own employees who know us, and also who are very passionate. They're doing it because they work there as opposed to trying to get more work from us going forward. So,
thank you. And then I had a very specific question, which was the call center. What is the contractual requirement for timeliness? And usually there's two figures. One is timely response, and then call abandonment rate. What are those, and are they being met?
Yeah. So Sheldon, my operations head of operations now, but I'll tell you right now, doing open enrollment. We are it's a 90-30, meaning 90% of all the calls have to be answered within 30 seconds. That's doing open enrollment. As you might imagine, we have a hard deadline to get people enrolled. So we load up the call centers to make sure they meet that. The other, the abandonment rate, I believe, is 5%, daily 5% abandonment rate. Most days they meet both SLAs. They meet both of them, but sometime, typically on the Monday, that might be a struggle for them. And by the way, when they don't meet them, they do pay. There's a fee that they pay for. It costs them money when they meet when they exclude when they don't meet the target dates. And a lot of times there's a reason why they don't meet it. Right, it could be staff shortage that they know, and sometimes something happened in the media over the weekend that generates a lot more calls than they anticipated, and then the abandonment rate could suffer because of that. But that's something that we monitor every day. But no, not every we monitor it during the day because we actually have a screen that we are seeing what the abandonment rate is and what the wait time is real time.
Thank you for that information. And for comparison, the DSS call center is abysmal. It's an average wait of 48 minutes. So, I mean, beyond terrible. Actually, that's the call abandonment rate. I'm sorry, 48% is the call abandonment rate, and the I think it's 44 minutes is average response. So there's just a huge disconnect between the service they get to Access Health versus at DSS. And of course, that's not just Medicaid, it's also SNAP and everything else. Thank you very much for that information.
Yes, sir.
Thank you, Sheldon. I did have one follow-up question of my own. We mentioned the buy down rate that folks were buying down. Are we also tracking folks who may be just dropping coverage altogether because they're saying it's just too expensive, and what are those numbers if we have them?
So we don't have those numbers yet. As you know, we right now doing open enrollment, we know people who have come in and enrolled and those who have not. Right, because they have not enrolled yet. So what we do after open enrollment closes, we do what we call a leaver survey, where we the folks who have not come back into a re-enroll, we survey them and try to get why did you not re-enroll? We do that for our QHP customers. But right now, what we do in open enrollment is that when we those folks who are not re-enrolled, we send notices to them, we do outreach to them, text and call, reminding them re-enroll. Open enrollment is about to close. Please make sure you enroll by this date, so that you have coverage effective on this targeted date. So we do track it and we communicate with them when they have not enrolled, but we don't know what the actual non-re-enrollment rate is until after open enrollment closes. Then we do a survey. And we know exactly who have not re-enrolled, so we survey them to find out why they have not enrolled. Okay. By January 15th, January 16th, we're going to know exactly how many people who have not enrolled, re-enroll. Then we pick a sample and survey them, find out why.
Okay. Thank you, James. And I for that reminder, because now I do remember there was discussion of the leaver survey around the same time last year. So appreciate that.
Mm-hmm.
Any other questions or comments on open enrollment? All right, let's move on to federal changes and 2027 plan year planning update. And
Sure.
This is James. Go ahead.
Yeah, thank you very much, Mr. Chairman. Very quickly, I have some update on everything I'm about to say to you is basically forecasted. And again, to our connections with DC, now the organizations we are part of, namely NASP. So this is where we're getting this information from. Right now, there's a planned vote. It's supposed to be next Tuesday on December 9th. In the Senate to extend the subsidies. It was part of the deal struck with the Senate Majority Leader John Thune last month to end the government shutdown. The Democrats currently are proposing don't change anything. They are proposing a 3-year extension. That's what they're proposing right now. We understand that some Republicans are open to a 2-year extension, but with some caps, because they would need at least 60 votes to get it through the Senate, to get it on the floor in the Senate, and they would have to make some adjustments with caps and broker fraud prevention, create some new consent verification processes to get enough Republicans to support the proposal, so it could get on the floor with the 60 vote. The House apparently right now is discussion for an extension through a discharge petition. This is where the minority leader, I think he had 214 votes. He would need 214 members of Democratic make up the House. He would need at least 4 Republicans to sign on with them to force a vote in the House. So this is what we're hearing. As my understanding is that the Speaker, Mike Johnson, has not guaranteed to have a vote in the House, regardless of what the Senate does. So there's an effort going behind the scene. I think, publicly stated by the minority leader that that's what they're going to try to force a vote in the House through a discharge petition. So again, what I've said is that the proposed is that Democrats in the Senate are pushing for a 3-year extension of the enhanced subsidies as is. Some Republicans are proposing some change to 2-year extension with some modification. The best option for Access Health is a clean extension, whether it be 1, 2, or 3 years, because that makes it a lot easier for us to update our system and communicate with our customers. It's a lot easier to do that for us, the carriers, as well as the insurance department. If they change the parameters from what they are now, then it may take us a little bit longer to make the adjustments to our system to make sure our system comply with the changes. Just put that out there so you're aware that the potential confusion this may create for our customers. The Trump administration also talk about sending money directed to consumers through health savings accounts or flexible savings accounts to cover health expense. And I'm not so sure that has any traction across both parties. But he has mentioned that. And there's also discussions about the federal government going back to funding the co-sharing directly with insurance companies. If you remember back in 2017, 18, the Trump administration had defunded the co-sharing, and as a result of that, I think all of the states loaded the silver plans to include the co-sharing. So if they go back, and that also helped to increase APTCs, as many of you know, or all of you may know, is that the APTCs are calculated on the second lowest silver plan in each county. So because we loaded the silver plans to account for the cost sharing funding going away, it raised the cost, the premium for the second lowest silver plan, which drove up more APTCs for those who are receiving APTCs. If the federal government goes back to paying directly to insurance companies for cost sharing, that will lower the premium, which will lower APTCs. And that decision back in 17 or 18 cost the federal government a lot more money because the APTCs is a lot higher cost to them than the cost sharing were. Let me stop for a quick. If there are any questions, kind of that's a bit much that I stated.
Sheldon.
So thank you, James. We hope that Congress is going to do the right thing and extend these. You guys are in a terrible box because you're trying to give out information to people, and you can only you don't have the answers because everything's tied up in Washington. What's going to happen? My question is, the people who look at, I know you say, well, they were kind of expecting, the increases, so it wasn't quite the shock, but nevertheless, there are people who looked at the prices and said, no, I'm not doing it, right, and drop off. If we're lucky and they do it, but that's not done till now, or maybe even after a year, whatever, how do you get the information to those folks who declined, but you don't know the reason they declined, presumably, but you can guess. How do you get the information to them that actually they've been extended, hopefully, and so that there'll be a much lower cost if they come back? What's the plan for that?
Sure. So Sheldon, I'm glad you asked that question. We've put a plan together. We shared it with our board last month. We have a whole communication strategy that involves mass communication, meaning that everyone would get a notice from us. Then we would do specific targeted communication with those folks who have not come in, who have not bought anything at all. We would tell them that, hey, you know what, it's been extended. The premium, if you're still in a current plan, this is what it would be because of the extension. Because they all got notices from us back in October, forecasting if they stay in the same plan, what the new premium would be. And this is sticker shock they got. So we would send them the same notice, advising them, you can come back in and buy a plan. It's more affordable compared to what we sent you back in October. So we have a whole communication strategy around that. And it's not just notices, but there's email, text. Even if we have to do robocalls, we will do everything we can to get them back to Access Health to buy health insurance, and promoting the lower costs for them. Again, there'll be everyone will get a notice. Then we would do specifically targeted notices. Again, some folks may have come in and bought plans, going from silver to bronze or gold to silver, because that's what they could afford. We would also do special mailing to them as well, advising them. They could come back in, purchase something that covers more. And as a matter of fact, it may be cheaper if you buy a gold plan or silver plan than what you are paying for bronze, because of the enhanced subsidies that have been extended. So again, it's a whole communication strategy that'll cover all bases. Again, doing direct mail, direct email, text to everyone, and some of the notices will be designed for a specific group of our customers, depending on their situation. And again, obviously, we're gonna need some time to update our system to reflect the changes. The enhanced subsidies going up. So yeah, again, one other possibility that we're considering is extending open enrollment beyond January 15th. But we have a documented process that we're going to execute, depending on what Congress does, and also when they do it.
Do you have that flexibility? You don't need to get permission from the feds to extend it based upon the state change?
No, that is solely up to us, but we try to collaborate with the two carriers in the exchange. But it's our sole decision to extend. I know the Congress, I think part of the bill that the president signed, they limit I think they proposed to limit to have open enrollment end on December 15th or December 31st. But that doesn't apply until, I think, 2027.
Thank you. Glad to hear there's a plan on that, because we hope they do the right thing, and if so, we
absolutely
can bring
we had a plan. We had a plan designed back in October. So once September expired, then they didn't extend. Well, we started putting together a plan. If they do extend in November, we do this. If they extend in December, we do this. January, we do this. Because the dynamics change, because folks may have bought a plan in November and paid the first bill already. And if they come back in and change, so the communication is a little different. If you have not purchased a plan, but if you purchase a plan and paid your bill, so things change depending on your situation.
Thank you.
Sir.
So I have a quick follow-up to that. If let's say the tax credits are extended, are those going to be just automatically applied to everybody's account, so to speak, or because there are some individuals who maybe accept less than the full amount because they know that they have income fluctuations throughout the year and they don't want to end up having to repay excess tax credit. So what's the strategy for that? Is it going to be an automatic addition or?
No, it would not be. It cannot be automatic because what you said, they have to come in and consciously choose how much they want. So they would have to come in and update the application to reflect what they want, and we cannot do it for them because obviously we don't know what they well, we don't know what the situation is. So they would have to come in and make a decision.
Okay, so that's gonna require additional capacity for
communication
for you guys then, not just communication, but additional capacity for the call center and
and that part of the plan is to our call center is ramped up through the end of January to accommodate open enrollment. So we would actually at the end of February, actually we would expand that beyond the date that we planned simply because whatever DC does, and that'll drive our timeline. And Tammy's team would be a big part of this because they're on the front line, engaging with the customers. Our graduates from Broker Academy would be a big part of this as well. So we have a comprehensive strategy in place involving our partners, us, but a big part of it is communication. Just intense, continuous communication, both publicly as well as directly to our customers, depending on their situation.
Got it. Thank you.
A couple quick final points. As you know, the General Assembly passed the legislation in special session last month that created a $500 million reserve fund to support to fill in gaps because of federal funding shortfalls, looking at healthcare programs, low-income home energy assistance programs. So we understand that some of that might flow to some of our customers. Again, they're waiting to see what the feds do, and we may get some support from the state, depending on what the feds do or don't do. Finally, 2027. We are looking right now. We are planning for 2027. We start that plan in January of 2027, and the focus for us for the plan year 2027 will be affordability. And how do we make these health insurance plans more accessible and more affordable for Connecticut residents? And again, there's a ad hoc subcommittee of the board that the HPBQ, I think you in that committee.
Mm-hmm.
All right, and that committee is made up of community members from the community, the two carriers in the exchange, and board members, and they look at that committee set the standards that the board votes on for the insurance companies to design the plans for 2027, and they start meeting in January of 2027. That concludes my presentation, Mr. Chairman.
Thank you, James. Any further questions? Comments? All right, that takes us to our strategic initiatives.
So we have a couple of items to talk about. Sheldon, going back, just to give you a quick update. This is some of the projects that Katie and her team are helping us to manage. They're very complex projects, big projects, a lot of moving parts. So we need somebody to have oversight, making sure the project plan is being adhered to and keeping us on track. Marquise.
So we'll turn it to Marquise.
All righty. Good morning, everyone. As mentioned before, I'm Marquise Davis, Director of IT for Access Health CT. Today, I want to give you an update on 10 Clicks, which is our modernization effort for our enrollment and eligibility system. As of September 30th, the RFP was officially posted. We're now currently in the evaluation process, which started October 31st. And here's just a quick illustration of where we're at in the process. The evaluation phase started October 31st of this year and will end February 20th of 2026. I want to note that in the early stages of the evaluation process, our legal team and IT security and compliance team completed their review on November 21st. The evaluation committee started their review on November 24th, and that process will go into mid-January. Oral presentations and reference checks will start around January 29th and go into February 13th. And the vendor selection and agreement process will begin on February 16th and go through April 30th of 2026. And then the final contract signing, that'll take place April 27th of 2026. And implementation will begin May 1st of 2026. And then finally, our target go live date will be June 1st of 2027. Next slide. So this is just more of a traditional Gantt chart, so you can kind of get a full visual overview of, you know, how the project started and how it will end. But again, recognizing the scale of this transformation, we built a deliberate and phased change management process. Staff across the organization will know what's changing, why it's changing, and how they're going to be supported throughout the life cycle of the entire project. And I also want to highlight our collaboration with DSS, and that continues to be a critical part of this project's development. Our early and ongoing collaboration with DSS has helped us ensure that our systems will work together. Eligibility systems and decisions are well coordinated, and we stay aligned on funding and reporting requirements with DSS. Their input has really helped us, you know, shape the solution that meets both operational and regulatory goals and ensures alignment with Medicaid and other DSS initiatives down the line. As many of you know, this is a major undertaking, but I'm happy to say that we are absolutely on schedule. I'm happy to answer any questions or walk through any parts of the plan in more detail if needed. Thank you.
Any questions
So-
for Marquise? Oh, go ahead, James.
Just very quickly, you know, Deb, this is something you and your organizations will be happy because, again, we've been using the same system since we went live back in 2013, and we have not made any changes, any upgrades at all, and it was built with I think about 20-year-old technology at the time. So now this system is going to be designed with everybody in mind, because the system that was designed and built, we didn't have any data about our customers, about our partners. We didn't know how any of this was going to play out. So we were just following the federal guideline. So now we are able to design a system that will help us meet our customers where they are, because we have a lot of data about who they are and how they like to use technology. Right now, using our call center to enroll anywhere from 45 minutes to an hour and a half, because the system is so click. We think that the advancements of technology, and we had a lot of stuff built into our system that may not be currently is not needed or necessary. So we've gone through the entire process, identifying everything that's needed. So we anticipate that this will become much more efficient, much more effective for people to enroll, and also our partners to enroll when people show up in the front door, and you make it a lot easier for them to enroll people as well. So we are looking for 15 minutes at most for someone to enroll, either on their own or through the call center. That's the goal. hence the name 10 clicks. Hopefully you'll be able to get through the whole process through 10 clicks. It's an aspirational objective goal for us, but we think it's doable. Marquise is leading the team within Access Health to get us there. We have a very detailed plan to get us to that point. And the first time we're going to be using this is for the 2028 open enrollment. But the minute we go live on June 1st, 2027, anyone will be Medicaid folks who apply or people who want to update their application, they'll be able to use it. Starting June 1st, 2027.
Great. Comments or questions? All right. Our last agenda item before adjournment. John, tell us about ICRA.
Thank you. Good morning, everybody. John Carbone, Director of Small Group Product Development Broker Support. I just want to share a quick update on Business Plus, our solution that lets small businesses and non-for-profits offer coverage in a way that works better for their budget and their employees. We're seeing strong interest, and it's clear that our model has been helping regarding, allowing individuals, groups to enroll in individual plans and find creative solutions where the traditional coverage has struggled. Over the past several weeks, our marketing strategy has been heavily focused on not-for-profit organizations that want to support their workforce and offer a price of where they can offer their coverage to their individual employees. We have sent out over 6,000 targeted mailers statewide, and another mailer is going out this week, an additional 6,000. And then right after the holiday, we're going to begin a series of non-for-profit webinars that help employers understand how Business Plus can help support their mission while providing meaningful coverage to their employees. Our broker network continues to be the major strength. However, with Connecticut no longer paying commissions on new business individual products and Anthem reducing their commissions from $18 to $10, our volume has been challenging, and we've been having to reach out to brokers and groups directly when needed too. Even with that headwind, we feel confident Business Plus allows us to show true value and work towards a solution that supports both the community and the employers and the broker community. That commitment showed in the activity. Brokers have already completed over 400 quotes on the platform, and we have staged over 300 members to be enrolled on January 1st. This week begins our Broker Rush Week for our final push to ensure that our clients are fully enrolled for July 1st, so that there's going to be more progress on the way. While we are focused on our membership, the most important part is we're going to continue to focus in on growth, education, and marketing to our marketplace to make sure all our employers and non-for-profits understand what Business Plus can do for them and how it can expand their coverage of the workers and their families. As we move forward towards a full rollout, we remain focused on execution, improving onboarding, strengthening our outreach, and ensuring that our brokers have the confidence and the tools to help them move forward. So at this time, I'll take any questions if anybody has any.
Any questions for John?
Thank you.
This might not be for John, but more just like a general question relating folks who participate in this program as employees. I assume those numbers, when they enroll in individual plans, those are going to be reflected in our open enrollment and special enrollment numbers as we track those.
Yeah, we'll be tracking them both ways on our side, on the Business Plus side, but also on the individual side to make sure we can show, where they came from. Most of this membership is coming from partially self-funded products and other small group carriers.
Yep. Okay. Thank you.
You're welcome.
All right. Well, thanks everybody for the information, all the updates. This is always very informative, always good discussions at these meetings. And before we adjourn, I just want to wish everybody a happy and safe and healthy holiday season with your families and loved ones. And we'll look forward to talking again in the new year. With that, I'll entertain a motion to adjourn.
So moved. Deb Poland.
By Deb, Second,
I second Sheldon.
second by Sheldon. Any discussion? Martin, let's call the roll.
Sean King,
Yes.
Deb Poland,
Yes.
Sheldon Taubman,
Yes.
Alisa Naira,
Yes.
Maria Matos,
Yes.
Jacqueline, thank you, and Jacqueline Sanchez. Thank you.
All right. Thanks again, everybody.
Thank you all very much. Happy holidays
Take
to all.
care.
Thank
Talk to you
you.
soon.
Happy
Bye-bye all.
holidays.
Bye-bye.
Happy
Bye.
holidays.